We are seeing an uptick in COVID-19 cases here in the United States, and we are seeing that prompt some municipalities like New York City to change their risk levels. Yahoo Finance's Anjalee Khemlani is here with the latest. Good morning.
Good morning, Julia. Unfortunately, we are seeing those rise in cases across the country, basically in all states except for three. The daily average for cases now jumping beyond 50,000 per day. And that is a concerning number. That's when we starting get into really climbing territory. The lowest we've ever been is single digit thousands. So just to show you by comparison there. And to your point, New York City moving to a higher risk level. Now the city's seeing nearly 2,500 new cases per day. And that's a jump from early March where they saw 600 cases. So that's how you can see really what's going on. And this is a concern, but not surprising. Really, a lot of health experts who've been following this have warned that every several months we should be seeing a new surge just based on what the virus has done so far. To that point, Trump's COVID-19 response coordinator, Dr. Deborah Birx, saying this weekend on Face the Nation that we need to brace for a summer surge. We know that the CDC has already reported that 60% of adults and 75% of children have antibodies from December to February. So that shows at least that there's a level of infection and vaccination, which is why we aren't seeing a really concerning rise in hospitals just yet. So that's the only real difference between prior surges right now. But immunity does wane, and so we do need to keep an eye on that.
And Anjalee, I know you're also keeping an eye on shares of Pfizer, which are under pressure this morning.
That's right, and that's based on results of a study that shows that it's not really the Paxlovid pill, the one that we know is being used by VP Kamala Harris, as well as others who are at high risk for severe disease, and that's what it's been approved for so far. That pill just finished a study where it failed to prove that it could be used as a prophylactic or a preventative medicine, and that's something that really a lot of experts have been looking at and waiting on to see the results of, because then it would really make it a true sort of magic pill for this virus, but that did not come through. So that's where the shares you see fall. By comparison, we know early on in the pandemic, monoclonal antibodies, for example, were really good at being prophylactic in some situations, or at least reducing the risk. This study the pill was given to individuals who lived with someone who was infected, and it didn't prove significantly effective in preventing infection.
Anjalee Khemlani, thanks so much.